Hello, this is Station. Hello, this video will be about panic disorder explanation station. In this station, you are sitting with a mom of a young man who suffers from panic disorder. And the most difficult point to be explained in this station is the definition of panic disorder. And as a rule, I prefer all the time to start with simple information that everyone knows and then add to it the more difficult ones. If the patient asked you, why I am seeing a psychiatrist, doctor, you can tell her, I can see that it's strange for you to sit with a psychiatrist while your son is experiencing physical symptoms, which is suggestive for heart problem. But let me explain to you that our bodies are prepared for dealing with dangerous things by experiencing some changes, like experiencing rapid heartbeats, and those changes are present just to help our bodies either to face the source of danger or to escape from it. And this is called fight-flight reaction. But for unknown reasons, some people can experience those changes in their bodies while there is no source of danger at all around them. And this can happen in episodes that stays for minutes, and they start abruptly and subside spontaneously after some time. It's called panic attack, and repetition of those attacks over a period of 1 month is sufficient to establish a diagnosis of panic disorder. And I think you agree with me that this is exactly what is going on with your son. And see what will be the reply of the mother to you. If she accepts that and starts to ask you about the etiology or causes of this, it will be well and good. But if she's still not convinced well with that explanation, you can add something like, to be honest, Mrs. Williams, the definite mechanism of panic attacks is not well known, but some chemical substance is present in the bodies that can respond to some medical treatments known to be effective in treating this type of anxiety. And you can continue the station regarding the etiology. It's good not to inform her about the etiology as just information, but try to make the conversation in two-way manner. I mean, if she asks you, what causes this disorder, doctor? Here you can tell her, there are more than one factor. I'm not sure if your son has one or even all of them. Family history of anxiety disorder can play a role in having this disorder. And stay silent for 2 seconds. She will tell you if she is aware that any relatives suffer from the same disorder or not. And then you can continue. The type of personality also plays a role in that. Anxious persons are more prone to experience this disorder, and just give her a chance to describe if her son's personality is anxious or not. And then you can add presence of life stressors is related to the course of the illness as a whole, but not linked to individual attacks. I mean, presence of sustained stress in patient's life can make the attacks more frequent, but we cannot link individual attacks with the specific situations, because as we all know, by definition, panic attacks shouldn't be precipitated or relieved by anything in comparison to specific phobia or social phobia, for example. This is important to be explained to the mother of the patient. And when you come to explain the lines of treatment, just tell the patient about those lines as efforts we can do to help her son. I mean to tell her, actually, we have a lot to help your son with as a management of his condition. We can commence home in treatment known to be effective in managing panic attacks, and you can start to explain the antidepressants. And then to tell her, besides, we can also provide him with talk therapy sessions or psychotherapy sessions that are effective in treatment of panic disorder. And you can explain that the talk therapy is composed of 2 components. One of them is to deal with maladaptive thoughts. I mean that attacks are lethal or life-threatening, and by working on that idea, the attacks are not that dangerous to the patient, and they will take their time and subside spontaneously. And by repeating this during the attack in the mind of the patient, this will be helpful for not to get so anxious because of those attacks. and also to inform the mother that there is a behavior component of talk therapy, which depends on controlling the stiffness in the muscles and difficulties in breathing associated with those attacks of panic disorder. And by relaxing muscles and controlling breathing and make it deeper and of normal rate, this will help the patient to get rid of the physical symptoms associated with panic attacks. And also don't forget to mention something about the role of the family. I mean, to encourage the patient to receive medicines and to attend psychotherapy sessions on time, and also to remember the ideas that the attacks are not lethal on coming of those attacks. And at the end, check that the mother doesn't have any more concerns, and don't worry about the time. Even if she still has some more concerns, inform her that you can sit with her in another session to address all of them, and also you can provide her with some leaflets to inform her more about this disorder. And thank you.